What would you do if a heart attack started right now? Not later, not in a hospital, not when everything is ready, but here, at home, alone, or next to someone you care about. Would you know what to do? Most people think they would. They imagine it clearly. Chest pain, collapse, emergency. But in reality, it rarely looks like that at the beginning. It starts quietly, confusingly, with signs that don't feel like an emergency. And that's what makes it dangerous, because the first minutes are the most important. Not hours, not later. Minutes. And what you do in those minutes can change everything. Today, we're going to talk about what to do when a heart attack starts, before help arrives. Because this is not just information. This is something you may need one day. For yourself. Or for someone close to you. And when that moment comes, there is no time to think, only time to act. Let's begin with something critical. A heart attack does not always start with sudden, intense pain. Sometimes it begins with pressure, discomfort, tightness, or a strange feeling in the chest. It may come and go. It may feel mild. It may feel confusing. Some people describe it as a heavy weight on my chest. Others say it felt like pressure, not pain. And because it doesn't feel dramatic, they ignore it. They wait. They hope it will pass. But this is the moment where everything begins. Now, imagine this. You feel discomfort in your chest. You sit down. You rest. It gets slightly better. Then it comes back. This point, most people make a critical mistake. They delay. They say, I'll wait. I'll see if it goes away. I don't want to overreact. That in that delay is what causes damage. Because during a heart attack, the heart is not receiving enough blood, and without blood, the heart muscle begins to suffer. The longer the delay, the greater the damage. So the first and most important rule is this: do not wait. If you feel symptoms that may be related to a heart attack, act immediately. Now let's go step by step, because when this happens, you need clarity, not confusion. To step 1, recognize what is happening. Ask yourself, do I feel pressure or discomfort in my chest? Is the sensation spreading to my arm, back, neck, or jaw? Am I short of breath? Do I feel weak or suddenly tired? Am I sweating without reason? Do I feel nauseous? If several of these are present, do not ignore them. Even if they feel mild, even if they come and go. Because early symptoms are often subtle. Now, step 2. This is critical. Call emergency services immediately. Do not wait. Do not delay. Do not try to see if it improves. This is the most important action. Because medical help is the only thing that can stop the process. And every minute matters. Now, here's something important. Many people hesitate to call. They think, what if I'm wrong? I don't want to make a mistake. But here's the truth. It is always better to act early than to act too late. Now, step 3. Stop all physical activity. Sit down or lie down. Do not continue walking. Do not try to push through. Because the heart is already under stress, and movement increases that stress. Now, step 4. Stay calm. This may sound simple, but it is critical. Fear increases heart rate. Stress increases demand. Try to breathe slowly, steadily. Focus on controlled breathing. Now, here's something very important. If you are with someone, your role becomes even more important. If another person is experiencing symptoms, Stay with them. Do not leave them alone. Observe their condition, talk to them, keep them calm. Now let's go deeper, because the next part is where most people make mistakes. Many people try to wait it out. They sit, they rest, they delay calling for help. They hope the symptoms will disappear. And sometimes, symptoms do decrease temporarily. But that does not mean the problem is gone. It means the process is still happening. This is one of the most dangerous moments, because the illusion of improvement leads to delay. Now imagine this. Symptoms appear, they decrease, you feel better. You decide not to call. Then, they return, stronger. That is exactly how many heart attacks progress. And that's why early action is critical. Now let's talk about something very important: position of the body. If you are experiencing symptoms, sit upright, or lie down with your upper body slightly elevated. Do not lie flat on your back. This position helps reduce strain on the heart. Now another important point: do not eat or drink. This is often overlooked. During a heart attack, the body is under stress. The swallowing may be affected, and eating or drinking can create additional risk. Now, here's something many people don't think about: time. Symptoms started. Try to remember when. This information is extremely important for medical professionals, because treatment decisions depend on timing. Now let's pause and understand what is happening inside the body. Heart attack occurs when a blood vessel that supplies the heart becomes blocked. This blockage prevents oxygen from reaching part of the heart muscle. Without oxygen, cells begin to suffer. This process begins within minutes, continues as long as blood flow is restricted. That's why time is everything. The faster help arrives, the more damage can be prevented. Now think about this. What if the symptoms are mild? What if it's just discomfort? That's exactly when action matters most, because early symptoms are the warning. Now ask yourself, would I act immediately or would I wait? Because in that moment, that decision matters. And if you take one thing from this part, let it be this: do not wait for symptoms to become severe. Act when they begin. Your body is giving you a signal. That signal is time. Now here's the part most people are not prepared for. What if the situation gets worse? What if the person becomes weaker, more unstable, or even loses consciousness? Because a heart attack does not always stay at the same level. It can progress, and it can change quickly. That's why what you do next matters even more. Let's continue. If symptoms are getting stronger, or the person becomes very weak, you need to stay focused. One of the most important things is this: do not leave the person alone, even for a moment, because the condition can change suddenly. Now imagine this: the person says, "I'm okay, I feel a bit better," and you step away. But inside, the process is still happening. And that's when things can change rapidly. Now here's something critical. If the person becomes very weak, help them stay seated or lying down. Support their position. Make sure they are stable. Now, let's talk about a situation many people fear. What if the person loses consciousness? This is where panic usually begins. But panic does not help. Action does. If the person is unresponsive, first check if they are breathing. Look at the chest, listen, observe. Breathing is present. Keep the person in a safe position, stay with them, wait for emergency services. But if breathing is not normal, this becomes a critical situation. At this point, immediate action is required. Now here's something very important. Many people freeze in this moment. They don't act because they are unsure. But doing nothing is the worst option. Even basic action is better than no action. Now let's go back, before it reaches that stage, because prevention in those minutes is everything. Another critical point, do not let the person walk. Even if they say, "I'll be fine, I can move." Movement increases strain on the heart. And in this situation, reducing strain is critical. Now let's talk about common mistakes, because this is where many people go wrong. Mistake number 1, waiting too long before calling for help. This is the most dangerous mistake. People wait, they delay, they hope. Every minute of delay means more damage. And it goes to mistake number 2, ignoring mild symptoms. Thinking, it's not serious. It's just discomfort. But heart attacks often begin with mild symptoms. Mistake number 3, trying to continue normal activity. Walking, doing tasks, moving around. Yet this increases stress on the heart. Mistake number 4, panic. Panic leads to poor decisions. Staying calm is part of the response. Now, let's go deeper. Because understanding what is happening helps you stay in control. During a heart attack, the heart is not receiving enough oxygen. This creates stress, damage, and instability. The body reacts, heart rate changes, blood pressure changes, breathing changes. And this is why symptoms vary. Some people feel pain, some feel pressure, some feel fatigue. That's why recognizing the pattern is more important than focusing on one symptom. And now think about this. What if the symptoms come and go? That's common. And that's what confuses people. They think, if it was serious, it would stay. But that's not true. Symptoms can fluctuate. And that fluctuation creates false confidence. Now here's something very important. Even if symptoms decrease, the risk remains. That's why action must happen early. Now let's make this very simple. If you remember nothing else, remember this. The chest discomfort, plus weakness, plus breathing difficulty, act. Do not wait. Do not guess. Do not delay. Now let's talk about one more important point, communication. If help is on the way, be ready to explain when symptoms started, what symptoms appeared, how they changed. This information helps medical professionals act faster. Now imagine this, you act quickly, you call immediately, you stay calm, you reduce movement. And that creates time. There's time for intervention, time for treatment, time for recovery. Now imagine the opposite, delay, confusion, ignoring symptoms. That reduces time. In this situation, time is everything. Now let's step back and look at the bigger picture. Heart attack is not just an event. It's a process. Process that often begins quietly. Gives signals. The problem is not that the body is silent. And the problem is that we ignore what it says. Now, ask yourself honestly, would I recognize these signs? Would I act immediately? Would I take it seriously? Because in that moment, there is no time to learn. Only time to act. If you take one thing from this video, let it be this: early action saves heart muscle. And that can change everything. Your body will always give signals, through discomfort, through change, through something that feels not right. The question is, will you act when it matters? If you found this video helpful, stay with our channel. We explain critical health signals in simple, clear ways so you can act when every minute matters. And in the next video, we'll talk about something just as important: what to do when a stroke starts before help arrives. Make sure to stay with us so you don't miss it.